To most of the world today, Egypt is a place of astonishment and unbelievable discoveries. When most of us hear the word Egypt, we think about its shockingly large pyramids or its well-known pharaohs and mummies. One might also recognize the fact that hieroglyphics was the first writing system ever developed. But among all of these findings, the chief objective that people fail to realize is that ancient Egypt is one of the first recognized civilizations to practice medicine in a systematic and well-documented manner. Even Homer stated in the Greek Odyssey that, in Egypt, the men were more skilled in medicine than that of any of humankind. Because of their accelerated development and use of hieroglyphics, they were able to document their findings in the medical papyrus, of which only a few have survived. Their methods of medical practice, among those recorded, reflect the modern approach to medical diagnosis and treatment. Due to the lack of knowledge based on experience, illnesses and their causes were mysterious to the ancient Egyptians. Spells and remedies were used by exorcists mainly because the Egyptians believed that the cause of illness was that of evil spirits and their poisons, and that cleansing the body would free them of all ailments. Prayers to the god, mostly Sekhmet, the goddess of healing, along with curses and threats, were accompanied by unpleasant medications in hope of proving effective as well. Physical medicines, such as herbs, were only expected to reduce the pain, while magic seemed to be the only cure. Experimentation and observation led to the discovery that physical medications supplemented the magical cures and could be used in conjunction. Magic is effective together with medicine. Medicine is effective together with magic. From the Ebers Papyrus. The mummification process involved dissection techniques and gave the ancient Egyptians a better understanding of the inner workings of the human body. Mummifiers removed the body's organs by ripping them out through a small incision in the corpse's flank, or in the case of the brain, scooping them out in tiny portions through the nostril. The first recognized physician was named Imhotep, also known as the father of medicine. In Egyptian, his name translates to the one who comes in peace. Not only was Imhotep a well-known physician in early history, but he was also considered to be the first architect and engineer. Due to the stability of the country, ancient Egypt's technology evolved at a much more rapid pace than that of neighboring civilizations. Such development led to more effective tools to be used for medical surgeries. Everyday complaints such as headaches and upset stomachs most likely went untreated even when remedies could be offered. The common cold was also among the illnesses that plagued the ancient Egyptians, as it still does today. The remedy consisted of milk of a mother who has given birth to a boy and was probably just as effective as anything we have now. The Egyptians were also conservative enough not to kill patients while treating head injuries, but they lacked the understanding of how and why the brain functioned and considered thinking to be a function of the heart. They did, however, make a connection between pulse and heart, but were still unaware of the topic of blood circulation. Physicians performed cosmetic surgeries and developed prosthetics such as glass eyes and wooden toes. They also provided lotions and urgents for skincare and produced remedies against hair loss and graying. Medications were even placed in pots and labeled with directions on their use. Ancient Egyptian practices and remedies has ultimately affected the modern world and applies medical treatment today. We have come a long way since the time of the Egyptians, and although most of what they believed to be true wasn't necessarily so, it has given us a basis to the understanding we now have today.